We know women struggled and kind of were hit with the whole pandemic, the job losses, the managing kids at home, so much being a caregiver in so many ways. And our data obviously showed that. But I think the positive that we didn't see going into this were the silver linings, the stories that women told us around the year and how they persevered and rose above it.
I am 23 and haven't gone through menopause yet. And I have always known menopause to be sort of a negative process, just coming from women who I've spoken to and things you see on TV. And after reading the Zeitgeist report, I have never read anything that was so impactful and so refreshing about such a natural process. And the detail in the report and how you've made me sort of feel like I can look forward to this process. And, I appreciate the data that you all have put together, and not only for women who are going through it, but for women who have not yet even started the process. So I'd love to know about the research process and the demographics of the women you spoke to and how that all happened.
Sure, absolutely. The Zeitgeist is that it's a capture of the menopausal woman annually, and we publish this Zeitgeist annually. We started it last year, or in 2019. We've got the 2020 Zeitgeist now coming out, and it's really just because menopause has been so misunderstood, and a taboo around women's health and so forth. We wanted to shed a light on who is this woman? What is she doing in life? She's living, she's alive. She's really kind of at the top of her game in so many ways relative to career and family and her own self-confidence. But she's also going through a lot of health changes with menopause. So the essence of the Zeitgeist is really to capture that. When we have gone out to field the research, the Zeitgeist is really made up of two data sources. The first one is an evergreen, ongoing data source that we capture throughout the year through our menopause assessment at Gennev.com. And that assessment is free for any woman to go ahead, answer these questions. It takes about 3 to 5 minutes, and it helps a woman understand then where is she at in the 20-year menopausal journey. That's one set of data, and that's kind of where we get a lot of the symptom data, like 96% of women are reporting trouble sleeping, or 94% are reporting emotional health challenges. That kind of data comes from that perpetual kind of longitudinal study that we're doing. The spot report around the more social, struggles, positives, etc., that women are going through, that captures the essence of the Zeitgeist, is an annual report. And we feel that this past year we had nearly 1,000 women respond to that, compared to the menopause assessment, which has now 120,000. So we're talking in big volumes of numbers of women. When we think about who we field it to, we really ensure that we're capturing a diverse set of women across ethnicity. We do ask the question around ethnicity and race because we want a really representative community of women that represents women in the US. So that's number one criteria. Obviously, we're not necessarily targeting women of different socioeconomic levels. It's just not one aspect that we have gone after to try to uncover with this research. But we do reach out to our existing community ourselves. We have about 250,000 women in our community. In this year, we also partnered with the MIT Aging Lab and worked with them in their panel, and then our networks. And from there, we get the responses that we get. Obviously coming through 2020, it was a very unique year, challenging for many. And so we obviously leaned into that. We know on average, 84% of women who take our Menopause Zeitgeist report some sort of emotional health or mood change or depression or anxiety or rage. And that's very common with menopause. But we really wanted to test this year in the Zeitgeist, looking past at 2020, did that just like put another layer of hardship on top of women? We know women struggled and kind of were hit with the whole pandemic, the job losses, the managing kids at home, so much being a caregiver in so many ways. And our data obviously showed that. But I think the positive that we didn't see going into this were the silver linings, the stories that women told us around the year and how they persevered and rose above it and what they were grateful for. We didn't set out to capture that. That just came as a result. And me as an optimist, I was thrilled to see that. But obviously, emotional health is a big one that took a hit last year. In terms of more women talking about it. And then the second one, we really wanted to lean into, are women still taking care of themselves? Are they doing preventative exams like mammograms and pap exams and even managing their menopause? And obviously to some degree, the self-care barometer kind of came down over the course of the year around preventative healthcare and just taking care of themselves healthily, primarily because they just didn't have time. They were managing family and new family members coming home in a way that they hadn't had in the past. And some of them had suffered job losses. So they definitely, heading into 2021, we really want to help them get back to taking care of themselves, putting on their own oxygen mask first before they take care of others around them. You know, I think more than anything, I was amazed at how, one question we asked around emotional health, because part of the reason why we do the report is also, how do we expand our health platform? Again, our providers help women with menopause related symptoms, and there's 34 of them. So there's a lot, whether it's a hot flash or sexual wellness or trouble sleeping or emotional health or fatigue. We wanted to kind of uncover, how do we start to dive deeper and also add additional new modalities specifically around emotional mental health. And a lot of women really came back a surprise. We kind of asked, what would be most helpful to you? Connecting you with a therapist, group sessions, additional mindfulness practice. We kind of wanted to test out what more could we be offering to support them emotionally. And I think probably the interesting finding out of that was more women really leaned into wanting more community and small group kind of therapy and support emotionally. And that's something that we as a provider with coaches and with gynecologists and the team of experts that we have permission to do that, and we can help them. So now in 2021, we've started piloting some emotional health community aspects to what we do so that we can support women in groups and smaller communities versus really going the traditional mental health the traditional mental health model. Yeah, great question. Thank you for asking. Number one, we want to reach more women. We've reached 1 million women in the last 12 months across the community and the education offerings that we provide. So that's goal number one, is growth. But number two, I think you'll see us expand more into more emotional mental health support for women. I wouldn't ever term us a mental health provider. There's a lot of incredible organizations that we can partner with and work with, but you will see us moving in that direction. Our vision is to serve the whole woman. So menopause is the kickoff to the second half of life, and how a woman manages her health during these formative years when these hormonal shifts are changing in her body will impact her long-term emotional health, but also brain health, heart health, and bone health. You'll see us moving in those direction over time, not necessarily in the next 12 months, but certainly we're going there in the future. Come to Gennev.com. It's GENNEV.com. And I always recommend, a lot of women are, like, where do I begin? Or I don't know what I need, but I think I'm starting to get into menopause, or you're totally in it, or you're late 30s, early 40s, or early 50s. Take that menopause assessment. First of all, get informed about where you're at in the journey. You're going to see the menopause journey map at the end. And you're going to hear a message from our Chief Medical Officer, Dr. Rebecca Dunsmore-Sue. And you're just going to be so much more informed. And what I like to think about is in control of your health. So that's step number one. Step number two, If you have questions, book an appointment. Our providers, our gynecologists and health coaches, service women in all 50 states. And even if it's just a conversation, book time with a provider. It's telehealth based. It's affordable. We've priced it as such, and come and start managing your health in that way. So those are the top two things I would recommend out of the gate. That's a great question. And I'm so glad you asked it, because most women don't think about that. They wait till they're already in the throes of it and they're suffering. I think for any woman who is probably in her late 30s or 40s, I'm 47 myself, I'm early in perimenopause, but the more curious you are to, again, first of all, take the assessment, because what that's going to show you is all the symptoms and the changes in your body that you might have a change in, or that might be impacted as your hormones start to shift. That's the first step, is just understanding how this impacts the whole you. Too often as women, we get treated for symptoms in isolation versus looking at the whole person. And the more we're informed about, oh, I'm not sleeping as well, and gosh, my moods have been really off lately, and my periods are so irregular, I wonder if I'm starting to edge into perimenopause. Knowing those signals is important for anyone managing their health. And so I would advise every woman, take the assessment. No matter where you're at, you're going to know what to watch for. And that's just like the basic thing that every one of us can be doing for our health.